Well, I've been reading Philip's book this weekend. It's a great read. It's a really simple read. I'll show you it again at the end. It's called Make Yourself Better. And in the book, Philip goes on to use a model to help get across what his approach to well-being is. And I think it would be really effective if Phil could take us through this model now. It's called the Wheel of Health.
Yeah, and this was created really because after studying all these sort of different ancient medical systems, I wanted to kind of put it together in a way that I could be able to sort of explain to my patients and people could grasp. And I suppose the idea is it is of this wheel. So essentially, there's all these different factors which are involved in making in being well. And I suppose the first factor is the wheel itself. So we know that people have different body types. And some people are better at, for example, or more inclined to, for example, some people are talented in different areas. Some people are really good musicians. Some people are really good academically. Some people are really good at physical work. You know, we all have our different tendencies and our gifts in a way. And that's the same in our physical well-being. You know, some people are particularly geared towards sprinting. Some people are geared towards doing long-term sort of events that like marathons and stuff like that. So we have different constitutional types, and we're not all the same. And I think that's the first thing, is that whatever approach somebody's taking, whether it's nutrition, whether it's exercise or lifestyle, we have to tailor-make it to people's individual constitution. And some people are blessed with really good constitutional health. And we know those people. They can drink what they like, they can kind of eat what they like, smoke what they like, and they die at 90 years old, right? We've met people like that. And whenever I lecture publicly about nutrition, people always say, oh yeah, but my grandmother, she did all the bad things, she ate all the bad food, and she's still alive now. So
sure. I can recognise that.
We all know people like that. And they're rare, but they do happen, right? Some people have this incredible ability to be to be healthy with the least amount of conscious intervention. The majority of people, though, have to actually make an effort. They have to eat good food, they have to rest appropriately, do the right kind of exercise in order to be well. So we're all on a continuum, and I think everybody can have a level of wellness, right? Everybody can feel well, but our lifestyle and our nutritional intake has to match our constitution, and that's a really key thing. Some people get really frustrated that they're not going to be marathon runners. You know, they just can't do it. They do it, they get injured, they get other problems. It doesn't mean they can't be athletes in other ways, but we have to match our lifestyle choices to our body type. So that's the first primary area, is the actual wheel itself. And that's according to the nourishment and nutrition we've had in our womb and in our mother's womb, and according to our genetics. So
there's very early factors that you once established, you may not be able to change at a later date, right?
That's right. They're things that are out of our control. For example, things like, were we breastfed? What kind of nutritional factors did our mother have when we were in the womb? What stresses or illnesses might she have had when she was pregnant with us? So there are these factors we can do nothing about.
Sure.
However, there's everything else we can actually make changes that are appropriate to make sure that we become healthy. So we have to be aware of our physical limitation, and once we know that, then we can make all kinds of choices, which gives us a lot of freedom. Actually, it's a bit of a paradox.